Hi everyone, my name is Claire. So for this video, I'm going to be explaining the DSM-5 criteria for major or mild neurocognitive disorder due to traumatic brain injury. So first, I'm going to briefly review the diagnostic criteria for major or mild neurocognitive disorder in general. So this is broken down A through D. A states evidence of significant cognitive decline from a previous level of performance in one or more cognitive domains, such as complex attention, executive function, learning and memory, language, perceptual motor, or social cognition. And this is based on two things. One, concern of the individual from a knowledgeable informant or the clinician that there has been a significant decline in cognitive function. And two, a substantial impairment in cognitive performance, preferably documented by standardized neuropsychological testing, and if not, another quantified clinical assessment. And then B, the cognitive deficits interfere with independence in everyday activities, and at a minimum, this is requiring assistance with complex instrumental activities of daily living, such as paying bills or managing medications. C, the cognitive deficits do not occur exclusively in the context of delirium, and delirium will be touched on more in a different slide. So then D, the cognitive deficits are not better explained by another mental disorder such as major depressive disorder or schizophrenia. The DSM then states that the person who is giving this diagnosis needs to specify what the major or mild neurocognitive disorder is due to. And in this slide, we will be discussing traumatic brain injury. So going off of that, the diagnostic criteria for major or mild neurocognitive disorders due to traumatic brain injury are broken down A through C. So A states that the criteria are met for major or mild neurocognitive disorder, which I just briefly reviewed with you all. And then B, there is evidence of a traumatic brain injury. That is, an impact to the head or other mechanisms of rapid movement or displacement of the brain within the skull, with one or more of the following: loss of consciousness, post-traumatic amnesia, disorientation and confusion, and neurological signs, which can include neuroimaging demonstrating injury, a new onset of seizures, which weren't occurring before, marked worsening of a pre-existing seizure disorder, or visual field cuts, and that's just some of them. And then C, their neurocognitive disorder presents immediately after the occurrence of the traumatic brain injury, or immediately after recovery of consciousness and persists past the acute post-injury period. So in this situation, one would rate the severity of the neurocognitive disorder, not the underlying traumatic brain injury. So that is important to note. So now I'm going to list some associated features supporting this diagnosis, which are listed in the DSM. So in major or mild neurocognitive disorder due to traumatic brain injury, associated features may be accompanied by disturbances in emotional functioning, such as irritability, easy frustration, tension and anxiety, and affective lability. Also personality changes, such as disinhibition, apathy, suspiciousness, and aggression. Also, physical disturbances such as headache, fatigue, sleep disorders, vertigo or dizziness, tinnitus or hyperacusis, photosensitivity, and reduced tolerance to psychotropic medications. And also, in more severe traumatic brain injury, features include neurological symptoms and signs such as seizures, visual disturbances, cranial nerve deficits, and also evidence of orthopedic injuries. So for development and course, the severity of a traumatic brain injury is rated at the time of injury. The initial assessment is rated under mild, moderate, or severe. So I'm going to break this down a little bit. When determining whether or not this injury is mild, you would take the following into consideration. So loss of consciousness for less than 30 minutes, post-traumatic amnesia for less than 24 hours, and disorientation and confusion at initial assessment is between a 13 to 15 on the Glasgow Coma Scale score. So then for moderate, you would be looking at loss of consciousness for 30 minutes to 24 hours. Post-traumatic amnesia lasts between 24 hours and 7 days. And then disorientation and confusion at initial assessment is between 9 to 12 on the Glasgow Coma Scale score. And then severe. This would be a loss of consciousness for 24 hours or more. Post-traumatic amnesia lasts for no less than 7 days typically. And disorientation and confusion at initial assessment is between a 3 to 8 on the Glasgow Coma Scale score. Also, the severity rating of traumatic brain injury itself does not necessarily correspond to the severity of the resulting neurocognitive disorder. The course of recovery from traumatic brain injury is variable, depending not only on the specifics of the injury, but also on the cofactors such as age, prior history of brain damage, substance abuse, things like that, that may favor or impede recovery. So, when assessing someone for major or mild neurocognitive disorder due to traumatic brain injury, it is important to take into consideration differential diagnosis and comorbidity. So this is also listed in the DSM, and I'm just kind of briefly review these with you guys. So under differential diagnosis, the DSM states that in some instances, the severity of neurocognitive symptoms may appear to be inconsistent with severity of traumatic brain injury. So after previously undetected neurological complications such as chronic hematoma are excluded, the possibility of diagnosis such as somatic symptom disorder or fictitious disorder needs to be considered. And then post-traumatic stress disorder can co-occur with the neurocognitive disorder and have overlapping symptoms such as difficulty concentrating, depressed mood, and aggressive behavior. And then under comorbidity, the DSM-5 states that for individuals with substance use disorders, the neurocognitive effects of the substance contribute to the traumatic brain injury associated neurocognitive change. So, in addition, some symptoms associated with traumatic brain injury are similar to symptoms found in those who also have PTSD. It is also possible for the two disorders to co-occur, especially in military populations. And that is what I have for major or mild neurocognitive disorder due to traumatic brain injury under the DSM-5 criteria. Thank you.